And then we can start the session. All right, ladies and gentlemen, welcome to session 7 of 10. So we are 7 weeks into the training or more. So congratulations to having made it to this point. 3 more to go, and then your manuscript to go. That's the capstone for this experience. It's not just about the course, it's about the research we are going to do in the end. So today we are going to look at critical appraisal. How I've done this is that we are going to just have a quick lecture on what critical appraisal is. You will have the slides, but then we'll move into hands-on. And for the hands-on, I'm going to show you guys extraction for one of the papers that you guys have already for the practice papers. And then how we are going to assess its risks of bias for that particular paper. And then you guys will have 20 minutes to then do extraction for the remaining 3 papers, or 2. We'll do 2, and then you guys will have as assignment the remaining 2 to do, because in the papers I gave you, there are 4 that have to be included and 3 that are gray. So you have to read the full text to be able to know if it's something you can include or not. So that's it. Just one person sent me their assignment. That means they are screening for both full text and short text. So that person is going to receive a surprise gift from me. I'm not going to reveal the person. The person knows his or herself. So thank you for sharing. But everybody submitted I think not everybody, but most of you submitted your set strategy, which was okay. But yeah. So that's it. Let's ride on. So risks of bias or critical appraisal, however you want to call it, it's really about assessing the quality of the paper you are looking, right? That's just it. And this is what you guys know. We are not going to talk about the quiz today because just 3 persons took the quiz, which is not very good for discussion, so it's fine. But this is where we are in the course. So you see that we are almost at the end. So risks of bias, that's what we are doing. It's very important that for any systematic review, you do a risk of bias, because you want to really be sure that what these papers are saying have not been compromised by either the method design or by any other thing. So we try to answer how likely the results have been affected by the way they designed the study, by the way they conducted it, or by the way they reported it. Right? So that's it. And so you can have bias based on selection, right? So you might decide to find doctors based on convenience, or your participants based on convenience, and that might influence the quality of your results, right? Most of the times in clinical trials, there's a concept of blinded, meaning the researcher and the researchee do not know if they belong to a treatment group or a placebo group. So if that is done, was it done very well or not? And then some people don't complete a study, they disappear. So that's what we refer to as attrition. And then, but some people will not report this clearly, like we have people who left or we have missing data. So things like that. These are the things we miss. And then we also have some people decide to report only positive findings and then don't report the ones that were negative. So again, you find that everything that is published is always positive. Oh, this new treatment works, but there's nobody challenging that. Oh, this new treatment works, but it does not work for everybody, or it did not work in our case, and so on and so forth. And there is a big thing about confounding. I mean, we'll be talking about this on a case by case basis, but confounding is where, for instance, if I want to assess the risks of cancer among people in Boya, for instance, I know that there are risk factors for cancers, for instance, smoking, for instance, alcohol consumption, for instance, sun exposure, depending on the cancer I'm looking at. So now, if I want to assess the prevalence of cancer, I would want to adjust, that's the word we use in statistics, but you want to account for these modifiers that can confound the true prevalence of the disease. So again, this is almost always common when we are doing with observational studies. So that's it. But the key thing for all of us to note is that um, biases may mislead the conclusion. So if a lot of studies did not say the right thing, then we'll conclude wrongly, even if we have 100 studies in our systematic review. So I hope this slide is clear, but I needed to say so. These are your learning outcomes, and we are going to practice that at the end of the lecture. And like I said earlier, we have progress check lecture and then demo, and then we practice, and that's how the lecture is going to go. Now, you always hear risks of bias versus quality versus certainty. Generally, risks of bias refers to the internal validity of the study. So how was the study conducted? And quality is basically an overall description of how you think the study was well done. It's not a numerical score. It's not something that you calculate and summarize. No, it's just you describing, and that's what you do at the end of your risks of bias, where you state the quality. Now, at the end of your systematic review, there's a great guideline that says, okay, this evidence is um good evidence, it's poor evidence, and the rest. And so that's done at the end. So that's what we refer to as certainty of evidence. But we're going to look at this in another lecture. So that's it. Now, risks of bias assessment varies based on the research design that you're using. So systematic reviews, they recommended is Cochrane RoB 2 score. And then you have Robbins for these studies. You have diagnostic accurate studies, which uses the Quadas tool, and then you have qualitative studies, which will have the CAPS or the JBI qualitative checklist. And then again, cross-sectional studies will still use that. But most of the times, your systematic review or your scoping review would involve multiple methods. And I'm a big fan of the MMAT tool, mixed model assessment tool, which gives you all of these things. So that's what we are going to look at. I'm going to highlight the other ones. You can look at them. If you decide to include only uh, randomized control trials in your study, then we expect you to use RoB 2. But let's just breeze through these things fast. So generally for each of the tools, you always have domains. I prefer to show this than tell you guys. So I'll show you how all of them look like. And in your program, I already uploaded links to where you can download the various tools and look at them. So for those who did that already, fine and good. If you haven't done that, it's already on your program. So so the main thing is to know the tool and know the domains that the tool assesses. So for RoB 2, you have a domain for randomization, deviation, missing outcome, measurement, and selection. So selection of reported results, and not just selection, but how the results were reported. So these are the core domains that you find in RoB 2. And how you assess them, it's by basically answering to what they call signaling questions. And then once you answer the signaling question, you move now to say, okay, was this high or low evidence of bias? And then at the end, once you've done that for all of the domains, you are going to give the overall judgment of that study. So, and it is always important that whatever thing you do, if you say it's high evidence, try to find a description from the paper that shows that it's of good quality. Generally, as a rule of thumb, I would want Afai, can you read the rule of thumbs?
If methods are described clearly as appropriately, like likely low. If randomized but no method details, use some consents unclear bracket depending on domain.
Yeah, good. So know that here you are assessing the risks of bias. So what you're saying is the bias high or low? So if somebody is clearly describing their method saying it's most likely there's low bias. So that's just what the rule of thumb is. So this is what is going to guide you when you're doing your assessment yourself. Thank you very much, Afai. Now for non-randomized trials, you have the Robins, and again, these are the domains. Similar thing. But here you have judgment in four several categories: low, moderate, serious, critical, or they did not provide any information. So you always have to know that there's always an option for no information in the data in the tools you're using. If you have a diagnostic accuracy study, so diagnostic accuracy study are studies that would assess, for instance, let's take the malaria rapid diagnostic test. Before it was made, they did a diagnostic accuracy study comparing it to what the virologists will look at or the laboratory technician will look at and count. So how accurate was it compared to the standard at the time? So that's what those studies are. And so you have some of those designs. And then there now you have to look at each of its own domains, which looks a little bit different. So you see that here we have a reference standard. So just like what I was saying. And then you have things like how do they select the patients? What was the test that they are testing? So in this case, I mentioned malaria rapid diagnostic test, something like that, and then the flow and the timing. So that's it. And then here, generally for case control designs, it's most likely a diagnostic study. If they say it's a diagnostic study, then it's a very challenging one. So you need to be certain when they do case control design, diagnostic is always very challenging because case control is for very rare studies, very rare diseases. And so you don't want to be doing that for a diagnostic study. If there's no blinding, so if you, the researcher, who is the laboratory technician, you know if this patient received a drug or not, then it might influence how you interpret the results. And so if they are not blinded, so there's a risk that there's a high chance of bias, something there. And then if there are no verifications or there's partial verification, it's also a challenge. And then if there is a time between when the test is done and the control test is done, if it's too long, there's also a chance of bias. So those are just things that gives you an idea that this might have some shortcomings. But that said, for qualitative studies, this is just descriptive. You are going to just have your discussions around how credible the study is, how congruent it is, how easily appreciated it can be. Is the ethics very well, and are all the voices heard or the voices of the research that you are interested in heard, something like that. So that's it. These are the common tools. So now I'm going to show you guys basically what we would do generally, how to go about this. And it's the same thing we're going to do for extraction. It's you take the study, first identify the design, and then know the tool you're using. And then most likely, if you want to assess for anything, it's always around the methods and the results. We had the highlight of that last week. And then you answer the signaling questions and all of that. And then you judge the overall quality and all of that. So this is a stepwise process that you can apply when you'll be doing your own. But that's it. Let's move to our demo. I'm going to stop sharing. And then we'll go back to the studies that we started last week. I hope all of you have those on your laptop now. But yeah, what I'm going to do is I need to put up another screen. Somebody is saying something. The first thing I want to show you guys are what these tools look like in real life, and I'm going to show you guys just Robin tool and then the MM80, which is what we're going to use for this demo. MM80 is something that I used as well for my publication. So for those of you who have read the paper already, you will have seen it there. It's in the supplementary materials, so you can download it and have it on your laptop. But if you are seeing my desktop now, what you're seeing is the RoB2 tool. So I'm going to maximize this so that it doesn't fill space. And it also comes with what we call a description sheet, a crib sheet. So you can learn what the tool is. I'm not going to take the time to read this, but all what this tells you is that you can decide to use this sheet instead of the Excel, but the Excel is easier. But you can decide to use this sheet because he has the instructions and then you're going to answer them. So you see that the judgment is on 4 levels: low risk of bias, moderate risk of bias, severe risk of bias, and critical risk of bias. And you see that there's little or no concerns with regard to this domain. There is some concern with regards to this domain. Um, Joseph, can you read the interpretation of the biases?
There is low risk of bias. There is little or no concern about bias with regard to this domain. Moderate risk of bias. There is some concern about bias with regard to this domain, although it is not clear that there is an important risk of bias. Serious risk of bias. Serious risk of bias. The study has important problems in this domain. Characteristics of the study give rise to a serious risk of bias. Critical risk of bias. The study is very problematic in this domain. Characteristics of the study gives rise to a critical risk of bias and such that the results should generally be excluded from evidence synthesis.
All right. Thank you very much. So this is, I mean, if you're using this tool, that is your guide, and it's similar for all of the tools. And so this sheet is just a very elaborate sheet to walk you through every step. But it's really laborious. So let's look at, this is the Excel sheet or the tool itself, and this is how it comes. So you see the intro there. And generally, you can click on here, which is assessment form, and then you do that. But we're going to do it. Unfortunately, the study I was looking at, the study we have, it's not a randomized control study, but we're going to mimic it just so that you understand how to fill it. So this is the tool. I want to bring in the study into your view so that you guys see what I'm talking about. It'll be difficult to show. It's too small. Is it clear enough in your screen?
It's too small, though. It's too small.
All right. Anyways, so this is just me showing you guys the tools, right? We're going to come back to it, but let me so when you click on assess form, a dashboard has appeared that you guys cannot see, but I'll bring it out to your view. So this is what appears, right? And this is where you basically fill what you want to fill, right? So the study ID will be what the study ID is on your extraction sheet, right? Or the assessment ID. So I'm just going to use the numeric number here, 1. I'm just going to put whatever I want to put. But we are going to fill this when we look at the paper I have just shown you guys, when we extract the information from it from our extraction sheet. Um, so that's the RoB form. I just wanted you guys to see it, but this is the platform. This is how you fill it. So you see that this is way more easier than using the Word document. So you see, this is domain one, which is randomization. And the first question you see is, was the allocation sequence at random? So did they randomize randomly or did they do it by a particular order? The second question is, what was the allocation sequence concealed until participants were enrolled? So this is to know if blinding was done. So again, you just need to say yes, yes, or possible no, no, or no information provided. So this is what all of this means. So that's it. And that's what you do for all of the questions, the same grading. And then the baseline differences between intervention groups and other groups suggest a problem with randomization. Again, yes or no. So that's why we say the most important thing to do is to read the methods. So that's it. I'm going to close this. And then let's look at the MM82, the mixed method tool. So the mixed method tool that I'm going to show you guys is what I filled for one of my published studies. So this is online, so I just downloaded it. And the difference between these two and the other and the RoB tool is that this allows you to assess studies of various designs. You see, I mean, this is just a very brief direction of how to use the tool, but I'm not you guys are going to read on this. But so let's go into the checklist itself. So you see here, I had the reference ID. This is the number of studies I reviewed. In my review, there were 20 studies. So you see, that's it. And then if we look at, can you guys see the screen or should I maximize it? I think I can do this. Yeah. So good. So if we look at the screen, you see that you have the reference ID, the first author, and let's just look at the first row and the second row so that you see how I filled this. And this is very easy. And this is what I'll tell you guys to use for beginners. So, and we go down and then you have the citation. So all of this is just describing the study. But the very first part of the tool is to tell you to have a screening question. The first question is, are there clear research questions? Do the collected data allow to address that research question? So are you going to say yes, 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 good. So that's it. Now, and then we go now, the next set of questions are for qualitative studies. So the advantage is that it has all of those various designs in one. So again, this goes, you see, for qualitative studies, and then you can go across and answer all of the questions if this was a qualitative study. The next is for a randomized control trial. So again, you go there, is randomization appropriate? Are the groups comparable at baseline? Is the data complete? Is the data complete? Are outcome assessors blinded to the intervention? Did the participants adhere to that? Now that is for randomized control. The next block now you see it's now for non-randomized control trial. So this is mimicking Robin. So this again goes, Lydia, can you read the questions for non-randomized control trial?
Okay. One, are the participants representative of the target population? Two, are measurements appropriate regarding both the outcome and interventions or exposure? Three, are there complete outcome data? Four, are the confounders accounted for in the design and analysis? Five, during the study period, is the intervention administered or exposure occurred as intended?
Good. So that's it. And then we move to the next section now that we have quantitative descriptive studies. So these are like cross-sectional studies. So again, this is what we see here. Patrick, can you read the questions here?
Alright. This strategy relevant to address the research question is the sample representative in the target population. Are the measurements appropriate? Is the risk of non-response bias low? Is the statistical analysis appropriate to answer the research question?
Good. So you see, right? That's it. And then the next block is now if it's a mixed study, a study that does both quantitative and qualitative. And then you'll see now that when we go down, you have to drop your comments. So here you see, I said some of the participants didn't attend the focus group. So this was for a qualitative study. And then I most likely gave a score of 5 because they did everything well. And then this one I said pre-post design of stroke survivors randomized by flipping a coin, assessor not blinded. And so I rated it 4 and 5. So it gives us a score of 80. And that's what you do for all of the studies. So if you see, I had 20 studies in this review included. So you see that I read almost 3,000 papers to end up with 20 reviews. And that's what I was saying to you guys. If you are going to have a good systematic review, you need to have at least 1,000 in your capture first, because the fact that those 1,000 will be included is really low. So that's how we do risks of bias assessment. Now, let's go to mm, mm. So last week I gave you guys these studies, right? Generally these are the papers that you should include. For those who completed, just one person sent me their thing. These are the papers that you should include. So I'm going to copy paste this on WhatsApp. And then these are the yellow papers. These are the papers that I needed people to read full text so that it appears in your so that you judge if it's going to be included or not. But we are going to just discuss if we should include these papers or not. Do we remember the research question? Do we recall the research question? All right. I don't expect you guys to recall. So the research question was basically that it's our study, right? So the study was in an African population of people with cardiovascular disease, at risk of cardiovascular diseases, how does AI-based cardiovascular risk models compared to standard risk scores affect the accuracy of predicting cardiovascular outcomes? So that's what we're working with. And we've done this already. You had this as your handout to follow in order to do the screening properly. And so obviously I was expecting all of you to send me your Excel sheets for screening. And then today we are going to look at the extraction proper, which is basically this sheet. Sorry, I have this on another screen. My screens are swapped. So this is basically this sheet. So what we are going to do is we're going to extract data just for one study. I'm going to extract data for one study, and then we're going to use that study and do its risk of bias assessment using the MM80 tool. And then you guys are going to then work with with 2 studies from the 4, and then there will be 4 studies left for you guys to do as homework, of which the other 3 are most likely to be included or not. But I'll let you guys reflect on that, and then next week when we come, you guys are going to tell me if those 3 studies should be included or fully excluded based on you having read them and assessed their risks of bias and extracted the data. So again, the person who sent me this assignment last week, I'm going to contact you and send you a small gift for your good work. Now, I'm losing my train of thought. So that's it. So I need to bring the paper close to my extraction sheet, and we're going to do speed reading together. I hope nobody is sleeping. So we want to extract data from this study. So the first thing I do is just to, first of all, just copy the title of the study, because that's what I'm going to copy. And I'm going to bring it here. I'm going to ignore study ID, all of these ones. I'm just going to put the title. right? We assume that you understand that you have to put all of these ones, but I can also put the year. So I'm going to come and look at the year that it was published, which should be 2025. So quite simple, 2025. No, not 2005, 2025. So that's it. I'll skip the journal. Now, where was the study conducted? It's clear, it's even on the title, it's Ethiopia, right? So that's easy. So this is how we extract data. Even if you are on Ryan or whatever, you will still have to do these things manually, but that you're going to create it on their platform, which for me I don't like. I prefer to have it locally, so that's why we're using Excel here. Those platforms are mostly good for title and abstract screening, where you need two people to do it blindly, right? So that's it. So that's it. I mean, I can take the first author's name because it's always good to have that. Yeah. So I'm going to put him there. But that's fine. So we have the basics of the study region. And which part is you guys are going to solve that? But what setting was the study? So let's go to methods. I mean, I can read the abstract, but it doesn't tell me much. The data comprised of 30 instances of features sourced from the Ethiopian Public Health Institute. This prediction was a socio-demographic design using support vector machine learning and all of that. So let's go to the methods. It doesn't tell me much. So you see that I'm not trying to read everything. There are particular sections that you must read, which the method is definitely something important. So I think I'm already seeing the method somewhere. So this is methods around here. So in this study, we aim to develop a machine learning approach for predicting cardiovascular disease among individuals with diabetes. So this study definitely has to be included in the systematic review because that is the objective and that is what we're actually looking for. So one tip for you guys is that to test your search strategy, you need to find studies like this that fit exactly what you are looking for and make sure that whatever search that you do, that paper is captured inside. So you don't even start screening if you don't find that paper in the lots that you've captured in all the databases that you're working with. So that's it. Follow the systematic approach of data collection, which is fine. So the data set used for the study was 1930 records from the diabetes obtained from the Ministry of Public Health. So this, for me, if they ask me, the setting looks like it's a diabetic clinic report that they've taken. So for me, I'm just going to put NCD clinic because that's what I'm most familiar with. And then now, what was the study design? The study design just simply, it's a retrospective study because they're looking at data and then they're training models from the data that they took. So if we look at it here, you see that they had the target variable was the presence or absence of a cardiovascular diagnosis as documented in patients' medical records, where patients with coronary heart disease, heart stroke, that were coded as 1, and those without such diagnosis were labeled as 0. So again, this is a retrospective study, and they have developed a composite grading to say somebody has a disease or not. So you need to have those 3 things before you get a score of 1. So again, it's a retrospective design to test if somebody has a cardiovascular risk or not. So the best way to talk about this, it looks like a case control study because this is typically what a case control is. You go back in time and then you assess if people had a disease or not. So you can go back to lecture 1 or lecture 0, and I explained what case control is, what prospective cross-sectional study is, and what of that. So that's it. So I come now to my tool. So I'm going to put here case control design. What was the data source? It's the Public Health Ministry, right? It had a certain 1930 there. So that's it. And what year did they recruit? They recruited data from where do we see that? I'm going to go down. I didn't see that anywhere for how long the data was included, but 1930. What does this mean? Okay, guys. Slowly but surely, I am skimming through, looking if I'm going to see already here they're talking about building a machine learning model. So it has nothing to do with the type of data. And this is how you train a machine learning model. This is what we call a confusion matrix. So it shows how accurate the various features are. So yeah. Model development. So all of this is already methods, and these are feature selections. I'm not seeing much of the data there. So now that I'm not seeing what I'm looking for, I'm going to say no information, NI. Eligibility summary, I mean, it's written somewhere there, right? It's written here. So after securing ethical clearance, it included socio-demographic factors, the target variable. So already I can just come and copy this part because I know that everything that I want is there. Now, this is rough work. In the end, you're also going to have to summarize this. What was the sample size? They had a data set of 1930 medical records. So that's a huge sample size. So 1930 medical records. What were the cardiovascular events of interest? It's also here, right? So this is like my winning paragraph. So what did they say cardiovascular events were? So coronary heart disease, heart failure, and stroke were coded. So I'm just going to abbreviate them, yeah? CAD, stroke, and heart failure. Those were the three studies. I don't have this information because of a training data set, but let's go now to the results and see if we'll find that information there. In the data set, no, this was just for model training, so it's not applicable. I'm not going to find it. Yeah. So this is age, 1930. This was the mean age. They didn't have gender in their database. So, but we have mean age. So I can report mean age, but I will not be able to report. So there's gender, yes. So yes, we have gender. So male was the most common. And then these are the other risk factors. So all of this information is available. So what do? I come first. The mean age was 47. Mean age was 47.7. It did not give me percentage female, but I'll flip the coin. So if I have frequency of males to be 4637 divided by 1930. Just going to do that. 4637 divided by 90. I thought somebody would have calculated, but no, you guys are not kind. So it's 51.4%. 51.4%. So I'm going to put 51.4%. So this is 49.6%. And that's it. So again, that's it. So the the target outcome was a CVD event. What's happening? Something has happened to my data that I've entered. Okay, nice. So the target outcome was a CVD event. So I'm skipping this because they did not assess risk factors. It's not the code. It's just they are going back. So it was CVD event, which is equals to stroke, heart attack, and heart failure. So that's it. How did they ascertain the outcome? It was definitely reported. And yes, they use machine learning tools. So yeah, I think my yes, no should work. Yes. And the algorithms that were used, we have support vector machines, logistic regression. I'm saying this because I've read the paper. So yeah. So if we come back here, you're going to see these are the various models that were used. These are them. So logistic regression, support vector machines, artificial neural networks, random forest, and um, what is GBM? I've forgotten, but I mean, these are the various models that were tested. And then these are their accuracies and how they train the data. So all of that is good for you guys who don't understand machine learning yet. The paper might be very technical for you. That's why I took it. But again, now we come and look at the results section and see what they describe. So across all models, total cholesterol, hypertension, total cholesterol, and fasting blood sugar consistently emerge as top predictors. So all the models predicted hypertension, and these are the big risk factors. These risk factors were consistently linked to increased risks of validated by each future important analysis across the region boosting model. The results for each models are outlined in table 3, yes, which display their values for each performance metrics according to the analyzed data set. Gradient boosting models achieved a accuracy score of da 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 da, da, and among models, SVM had the lowest performance accuracy compared to this. So this is all about the result section. The rest is just discussion because they are trying to propose machine learning tools that can be used to predict cardiovascular risks. So now that I've read that, yeah, same thing here. I can just copy and paste that. And then predictor domains use. Predictor domains simply still means like those risk factors. So hypertension, cholesterol, da 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 da. Uh, I haven't checked this, but I think they did for missing data. And then feature selection. Yes, they did that. That was done. They selected features. They did a 90:10. So they trained with 190% of the data and then they validated with that. External validation, no. They didn't do external validation in their study. So that was no, so I'm not going to do comparator scores. Yes, they reported comparator scores for all of them. And then, yes, they reported this. So this is what they reported. Yeah, AUC and all of that. So I can just come and copy all of this and put on that table. The other details are in there. So that's it. Discrimination, see that not very relevant. Calibration reported, maybe I didn't check, but that's it. So we can go on and on, but now you can assess the clinical benefits and all of that. So all of these are tools. I mean, you don't need to bother about funding, but I mean, that's it. Implementation describe all of that. You'll find this in the discussion. So if we go to the discussion, they would have discussed how useful the models are. These are the various models and how they performed. So you see, this is where they train. The training is a blue test and then they test accuracy. So basically, this is how you report machine learning things. But these are all the discussions, blah, 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 blah. And you find all of those details there. But I'm going to stop here. And now, for me, if I have to assess this study now for risks of bias, so guys, any question on how to extract data? The basic principle is you need to know the questions that are relevant for you. So these questions that I added for this particular tool is just things that I think are relevant for an AI-based topic, right? So we always need to know how it was assessed to be accurate, what was its sensitivity, what was the specificity of the model,
Doc,
because it's a new model.
the sound.
You cannot get me. Hello? Hello? Patrick, can you guys hear me? If you can hear me, unmute and talk now.
Yes, Doc, I can get you.
All right. So basically, these are questions that are relevant to the topic. And so for your own studies, you might not have the same columns because you are going to formulate this. So you guys now see that from when we finish your proposal, the next big thing that we need to do is discuss now your extraction sheets for each of your topics. What are those relevant questions that we need to include when we are extracting from each paper? Because you already need to know, all right, what am I going to be assessing? How am I going to do that and this? And that's how you build your extraction sheet. Now, this you have as a template. You can always just edit the column names and all over these things. But feel free to use anything that you want to use. But you need to be clear that after you've given the generalities of the studies, and then you need to come now and start giving us the real details of what are those key things that you are looking for in your systematic review. I also showed you guys the paper that I published, which had different designs for the extracted studies. And you would also see that I don't think I will need to search the internet, but that was going to take time. But that's how we do extraction. Now that we've done extraction, if we have to assess this particular study for risks of bias, for me, I know that the risk of bias here is low because I appreciate their methods and everything. But let's use the MM82 to go through its bias. And where did I store that? RoB tools. Oh, the raw one. Oh, I think I only just, okay, yeah, this is it. Very nice. So this is an on field form. So this is how you when you download it, you receive it. So again, we're going to do the same thing, right? Reference ID citation. So the year is 2025. I think the author's first is Athene. Yeah, I hope I spelled it correctly. But screening question, are the research questions clear enough? So let's go and look at the research questions. Oh, bro, I don't need you. Mhm. So I think the research questions are clear now because I saw a very long paragraph with the research questions. So somewhere down here, literature review, um, research gap, research questions. So this were it. Finally, this study seeks to answer the following questions. Which model was the best effective to predict cardiovascular disease among diabetic patients? Which features were the most important risk factors for cardiovascular disease among patients? So the research questions are clear. Do we agree as a team?
Yes, doctor.
Yes, Doc.
Good. So again, I come here. Do the data collected allow us to address those research questions? So let's go to the quality of the data. Do we think that a data set with 90,000 diabetic patients can help us to be able to assess the risk factors? 9,000 retrospectively.
Yes,
Is the
Doctor.
data
Yes, doc. 9,000 is quite a huge number.
good? So yeah, nice. So I think so too. So again, that's it. So yes. Now, the study is not a qualitative study. Do we agree?
Yes, doctor.
Um, is it a randomized control trial?
No.
All right. All right. I'm trying to zoom in so that you guys can see. Is it a non-randomized study?
I think it's a case.
hope. Mm,
All right. So yes, that's it. We already spoke about it. So it's a quantitative observational study which falls under case control categories. So this is where we need to assess it, right? So is the sampling strategy relevant to address the research question? I think it is because they just got a data set from the thing and they involved everybody. It's like everything that was in that data set that made it. So I would say yes. Who else thinks otherwise? Mm, Somebody's mic is open. I think it's Patrick. Mm, I don't know if he's having problems with the girlfriend, so that's shouting at him now. Yeah, so I'm going to put yes here. And then is the sampling representative of the target population? Yes, it is. They took database from diabetic patients. Are the measurements appropriate? Again, I can only say yes. Is the risk of bias, of non-response bias low? Yeah, the risk of non-response bias is low because they had everybody. Yeah. And then is the statistical analysis method very, yeah, I think it's appropriate. So you see that, yeah, we are done. So this study is fine. And then I'm just going to give my comments here. I would say uh machine learning model accuracy assessment with 90/30 patient records from Ethiopia Ministry of Health. Good. So that's my comment basically. And yeah, so with this, we see that we are very okay with what we have. And so I can proceed with my next study. One column is missing. I don't know. The column where I need to grade whether it's 5 or it's 4. Uh yeah, I don't know why it's not showing up here. But yeah, that's it. And so if I have a second study, I'll do the same thing. So it's that when you've read the paper already, when you've just extracted ideal risks of bias, it's quite easy. So that's the end of my demo. Do you guys have any questions? Now, you see that we cannot use RoB2 for this study because it's not a randomized control trial, right? So if you want to use those other tools, you see that you have to group your systematic reviews. You are going to pick the studies that are randomized control trials and use the RoB2. The ones that are observational, you use the Robin, and then the other ones are qualitative user. But if you use only this one, you can put all in one Excel sheet, which is easy.
the,
So, mhm.
okay, I see that this tool is quite better for us beginners. I think that would be the best one. Now, my question is
Yeah.
that
Mhm.
when you are finished when you are finished this training and the instruction sheet also, and then now you have to fill now this tool. Now, by the end, that is, if you when you finish including all your various articles here, all the various studies you have included in your systematic review now, what tells you that okay, uh, my work is that is has a low risk of bias or a moderate risk or I don't know. What tells you that?
No, no, no. I so let me go back to the one that has my field studies. Where is it? This one, right? So you see here, right? At the end, you have a score which is on 5. right? So if in the end you look at it, you are going to report it this way. So just pause. I'm going to show you guys how we report this. But I want you guys to practice and then we do that. But in the end, you report that, okay, in my systematic review, we had 5 papers. And out of those 5 papers, 3 had a score of 5 on 5, which means they were very low bias. One had a score of 4 on 5, which means there was also low bias, and then a few had 3. So you see, that's what I had in my assessment. So I think that there was very low bias involved in the studies that we used. That's just how you report it. Have I answered your question, sir?
All right. Understood.
Mm-hmm. Mm-hmm.
Please, Doc, I wanted
So
to know how the scoring is done and who does the score.
you are doing it now. You're doing it as you're
Is
doing
there a
the study.
criteria for
No. So
okay?
let's say there is 1, 2, 3, 4, 5 questions, right? So if somebody has yes in all 5, obviously the score has to be 5 on 5 now. But if the person had 1 no, then that's when you're going to score the person 4, right? Like this particular study, they had 4. So let's go to where I assessed it. So you see there was 1 no here. So you see now that the overall score is 4. Let's come to the 3 guys. We go back here and I note they had 2 no's. So that's why they had 3 on 5. You get the point?
Yes, doctor.
That's how the scoring is done. Yeah. All right, guys. So I'm going to divide you guys into 2 groups. You guys have 15 minutes to look at 2 papers. So approximately 5 minutes per paper, with some buffer, to look at 2 papers in the folder of papers to practice. So I'm going to share my screen again one last time so that you look at, I'm going to give you guys the author names. I'm going to just copy that and put on WhatsApp so that you guys can easily see. So we have looked at Athene. This is what we looked at. So you guys don't need to work on this one, but you guys are going to work on these 2, do their extraction and do their risks of bias. And then we meet after. And then your homework will be to complete the rest. And then we will discuss next class if this one should be included or excluded. So I'm going to copy these 2 and put on WhatsApp just so that you remember the names. But you can already see the PDFs if you downloaded the PDFs, all of them, you should be able to know the authors already. And for people that did the screening detailedly last week, you already have these things to use to access to extract data. So that's it. So you guys have, let me share my screen. You guys have 15 minutes to do that. I'm going to just split you guys into 2 groups like we always do. And then deliberate in your group. And then you're going to give your judgment in the end based on what we've discussed. So this is where you guys will be. I'm going to stop share. I'm going to, where is the group? If I paste an image, these guys will tell me that they don't have data. So let me paste as text. All right.
Please, the work is to do the extraction of the 2 papers.
Yeah, you're going to do extraction and risks
Doc.
of bias. Extraction and risks of
But
bias.
I don't have the NMAT tool. I don't have it.
You
Web
don't
solar identity. Okay.
you had to have it since last week, sir. I'm going to drop the PDFs in the
Hey,
WhatsApp group. Don't worry. But I'm opening you guys. I'm sending you guys to breakout rooms now. Join your breakout rooms. I'll send the PDFs on WhatsApp.
alright.
So I've sent both papers to the WhatsApp group, so you can download it from WhatsApp if you don't have it. But these were already in your data sheet. And yeah, I'll see you guys. I'll check in on you guys at 5 minutes. Frank, you need to join your breakout room. All right, guys. How was the experience?
Man, Doc, 10 minutes is over like that.
I gave you guys 15. It's it's 32 past the hour. And we left at 15 past. So anyways, you guys are going to continue with it. So I think continue in your group, and those who did not make class today, let them form their own absentee group and work on the remaining papers. But what was the most challenging thing for you guys? Anybody wants to share? Lydia and Afai.
Um, okay, doctor. My own main challenge with it was to interpret what the sheet actually meant by. I think it's going to take a while to understand the various terms in AI, like they said outcome, ascertainment, prediction horizon. It's like I don't really know what they're referring to, and then I'm reading up and down, and I'm not really able to understand what I'm looking for in a paper. Algorithm family, I want to copy all the algorithms or what. It's a lot of things happening at once.
Yeah, sorry that I chose machine learning paper, but feel what you can feel, right? The
Yes, sir.
the learning here is that those questions are unique to that paper. So for your own extraction sheet, you have to think of similar questions based on what your outcome is, what you're assessing. So that is why it is the way it is. But I get the
And
point. Just make sure
oh,
that you are able to say, okay, I have assessed, I have extracted what was done in the methods, what was done in the reported in the results, and that I'm able to answer the research questions. It's okay.
okay. And doctor, in this, I think this paper too, they assess several different models, their
Yes.
application. Yes. So it's like we're not just looking at one, because the research question was like one particular AI model to standard care, but this is like different AI models compared to each other.
Well, I would let's just go and read the paper more. We'll not argue
Okay.
on that one.
All
But
right.
yeah, they assessed various models and how they performed. But our research question is to assess standard care and models. So this study is already doing models alone and assessing how well they do. So it's now left on the researcher doing the review to group this as a study that is working on AI models and data only, right? Something like that.
Okay, thank you, doctor.
Mhm. Any other worries?
Doc, uh, are we there, please?
Yeah, I can hear you 515.
All right. All right, Doc. We could not really complete the extraction sheet because we had some problem. I think Joseph is not at home and network and that he does not have his machine in front of him. So we just try to complete with the MMHC tool. And also concerning the extraction sheet, I think we it's quite difficult to do that in 15 minutes. Seriously, if you have to go through the various papers and try to understand what each of the wants to do, it's quite
I
difficult.
gave,
I've
I gave you
tried,
just
but
two papers.
yes,
I gave you
Doc.
just two papers. Two like that, two tiny papers. And big 15 minutes. Okay.
I think we really need more time. We need
It's
to have more
okay.
time.
No, no,
Yeah.
you guys are going to continue in your groups to do this and do the other papers. So they are in total uh, s- uh 6 papers, excluding the one that I did. So you guys
Yeah.
have the entire week to work on it in your groups, right?
Okay. All right.
Mm-hmm.
Yeah.
Mm-hmm. All right.
But
Thanks
then,
for the feed. Yeah, thanks for the feedback.
so I
Yeah.
wanted to discuss about the risk of the assessment, the risk of bias assessment tool that you sent. For me,
Mm.
I don't know where, but because Bisala, the year 2025, the citation predicting stroke with machine learning, predicting stroke with machine learning techniques in a sub-Saharan African population here. Concerning the clear research questions, other clear research questions, I put yes. To the collected data allowed to address the research question, I also put yes. Now, I think it's a non-controlled trial or substitution with home. So I don't know. All of my questions, all of my the answers, all my answers were yes. So I put a score of 5.5. I don't know if that is what you had. Now the
Uh,
second
I'm
one,
I'm not going to give you an
sorry.
answer for it.
Oh my
I'm going to
God.
you and Joseph, you guys are going to brainstorm and present your final answers next week.
All right.
So next week, each of the teams are going to present their final risks of bias and extraction sheet. So
All right.
one person is going to present the extraction sheet, another person is going to present the risks of bias.
All
So
right. But please, lastly, I don't know
mhm.
if you can
Oh, I can't hear you, Patrick.
hello. Hello.
Yes, you don't know if I can.
Yes, if you can highlight to us the various points in the instruction sheet which are obligatory, that we must automatically fill it because there are a lot of questions there that to fill. I don't know if we are able to understand first of all what is
All
required from
right.
us before we try to fill it.
Thank you. Let's do that. Let's do that right away.
All right.
So extraction sheet. Yes, no, this is RoB 2. This is the extraction sheet. So
Yeah.
please note, I mean, this is being recorded so you can see it. So definitely things that you need to note is let's start from country, the region, the setting, the study design, the data source, how long it was recruited. If you don't find it, then you should put NI, which means no information. And then you should give the eligibility criteria summary from the study, the sample size a must, which cardiovascular events were reported. Then, I mean, you can skip this one. These are nice to have, but you need to tell us the risk factors that were discussed in the cohort that are going to be assessed using machine learning. It's the same thing. The risk factors can serve the same as the outcome. It depends on how they put it. But this one in this study, they used the outcome as this. But again, you had risk factors like cholesterol, hypertension that were assessed in that study. So you need to state those risk factors. So this one is very important because that's like the key thing from the research question. That's like the key thing from the research question. And then you have the outcome, which is having a cardiovascular event or not. However they define it, you need to be clearly state how they define what the cardiovascular event is. In this other study, it was 3 things to 1. Yeah. And then how did they ascertain the outcome? This you can skip. So this can be skipped. Prediction horizon, you can skip it. but you must tell us if it's machine learning or fully AI that was used. You can forget about algorithm family, but copy all the algorithms that are mentioned in the study. So we are skipping this one. We are skipping this one. We are skipping algorithm family. You can talk about the algorithm. And then what are the predictor domains? Predictor domains is the same as risk factors, but now that is what is being used in the machine learning model. So this is a nice to have. If you can find it, yes, fine and good. But again, if you don't find predictors, which is strange, then you report that there were no predictors. And tell us how they handle missing data. Then let's forget about feature selection. This is more technical for you guys, and internal or external validation. You guys should forget about this one. Da, 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 da. But give me accuracy scores, comparative scores that were done. So you would always see an AUC somewhere there or a C stat. So give that one of those scores. It should be mentioned. You can forget about this one. Forget about calibration. Forget about this. If they mention sensitivity and specificity of the thing, report it. I mean, that one, it will be straight. You guys can mention it. If they talk about the clinical utility or the benefit of that tool, if it was implemented, fine and good. And then you can forget about the last two. If you don't want to write your initials, that's fine and good, and then you can keep your notes here. But in the end, you are going to grade if the type of participants were high or low risks, if the I mean, this is a customized risk of bias, but you don't need to put that here. You go and do it in the MM80 score. But so we end here. Is that okay? Is this clear
Okay, Doc.
for everyone?
It's still tough, but we'll try. It's really tough.
So when you say it's tough, what do you mean? You just have to read the paper
But
first, right?
yes. We have to read the paper. I mean, maybe it's the language. Maybe it's the language that is used in the sheet that it's not really easy to understand. But we'll just try our best.
Yeah, yeah, it's right. I mean, that's why you guys are paired, right? So obviously, guys, two heads are better than one. And you can ask questions in the forum when you're doing it if you have a challenge. All right. So let's wrap this up. So generally, you have your table. When you report, you always have a table, the study and the domains, and then a small narrative paragraph. Optional, there are many ways to present that. You can present it as a chat, but very nice. But this is what I was saying. You would always have a report that says among the 10 studies included, 15 were judged as low barrier, 10 were judged at this, mainly due to this, and W had high risk, primarily due to that. That's how you report it. So that's just it. That's how you report. So common mistakes, it's don't use quality scores and average them. So each judgment is done independently, but it's not a skill. And don't be overly lenient. If you see a paper that you like, but you think that you will not want to assess it very well. So that's what we mean. And don't punish a study for poor reporting without noting if it was unclear or not. So check if it's like you did not understand. It's better to say unclear than to just say it's very low. And make sure you justify in every domain that you're assessing, why you're assessing what you're assessing. This one we are going to learn about how to do synthesis and interpretation, but the risks of bias is a separate sheet. That's why you upload it as a supplement when you're submitting your manuscript. Yeah. And so, like I said, you guys are going to complete that too. Try to work in pairs. You can work individually and swap amongst yourself. But anyhow that you guys want to do it. So Lydia, those who are not present in class, you're going to tell them to form their own group and do the same assignment. So,
Okay, doctor.
mhm. And yes, that's it. And yeah, so start discussing your challenges in the forum from Tuesday. I am Patrick, or you can start
Yeah.
discussing from tomorrow. Whenever.
Yeah.
Yeah. And yeah, you guys should make sure that you as a group by Thursday, you guys have aligned on everything you want to do. And please send me the sheet to me by Friday so that in class we'll have it. You guys are going to present. One person is going to present the extraction, other person is going to present the risks of bias. So nobody's going to run. All right. Thank you guys for coming to class. That's the end of my presentation. And yeah, the most important thing is to know that we always do risks of bias in systematic reviews, but it doesn't mean that the studies are your systematic review is not of good quality. It actually helps you prove that you did a good systematic review if you do risk of bias assessment. So that's it. Right, that's it. Any questions, any burning questions before we take the selfie for the day?
Doc, I have a question now. Since you said there are 6 papers that we need to do the extraction sheets. That is since there were 4 that were included and we have done for 1, and then 3 are left. Now the 3 others are the ones that were maybe. Now since you
Mhm.
did not actually tell us which one were maybe, so what is the answer to the assignment you gave? So you need to correct the assignment. That's what I mean. So that you can know
Yeah,
that
but only
okay, this
but
was
but only one person sent their sheet. That's what I was saying, right? Only one person sent submitted
yeah,
the assignment. So
yeah.
I mean,
So
I'm going to drop on WhatsApp the titles of the maybe and the included. So you guys are going to work on them.
so
Patrick, come again.
yes, okay, I did not hear you.
I'm going to send a list, right, that says topic 1, 2, 3, 4, 5, 6, and the 1, 2, 3, 4 are included. And then 5, 6, 7, 8 are maybe.
All
Um,
right, thank you.
yeah. I'm going to put that on the table. And then these ones are topics to be excluded. I'm going to send the marking
All
guide
right,
on WhatsApp. And I'm
all
also going
right,
to
thank you.
put it in the email that I'm going to send after this. But it's going to
All
make the
right,
email
thank
very
you.
long, but I'll put it at the end.
All right. Doc, who is the person who sent you this sheet now?
I don't know.
All right.
All right. Any other worries, guys? Um, Otherwise, let's turn on our cameras and take the selfie for the day, and let's call it a day.